Welcome. So this is my medicine mixer, and tonight or this evening, depending on where you are, we have Runam Mehta with us. She's the founder and CEO of HealthCube, and it's in India, and she's an innovator in India who's doing certain things also that are having roots into Nigeria and into Africa. So she's, volunteered to have a chat with us on what she perceives are the parallels or the alignments between the African landscape, the health tech landscape, and the Indian health tech landscape. There is nothing as good as having insight into, an industry that you're dealing in. What it does, it begins to help you to shape your mind. It gives you hope. It also helps you to understand that what you're doing is not too far off. And if someone else has done it somewhere, it's possible that you can also make it. So let's welcome Runam. Runam, the floor is yours. We earmarked about 30 minutes for this chat. You could talk through all, or you could give some time for questions and answers as well.
Absolutely,
Okay.
absolutely.
I'll ask my
Thanks,
team
Anmola,
to please mute
for having
everybody.
me. And it's really my pleasure to be here on this forum. I'll just take a minute to introduce myself and my organization. I'm Runam Mehta. I'm a physiotherapist by education, but for the last 15 years, I've worked in the healthcare industry. I've spent the first 5 years building a corporate workshop business myself. Then spent 7 years building healthcare, the largest home healthcare in this country. And for the last 1 year, I have been working with recently took over as CEO, and we are really a device manufacturer, point of care device manufacturer, and we're trying to ensure that the depths of our country.
I think you're calling my flight.
Diagnosis.
You're on LinkedIn, yeah?
So that's what we are doing. I won't spend more time on this.
Sorry, Runam, there's a lot of noise. It's quite hard to hear you.
Let's connect on LinkedIn.
Can everyone mute, please?
Yes, we need everyone to mute.
LinkedIn.
Can everyone mute? Rutam, please hold on, please. Can everyone please mute your systems? Tolulope, please mute. I'm trying to mute you. Yeah. Okay. So people will mute as they come in. Right. Let's mute one. Then Runam, you can unmute yourself and please take it from the top.
Great.
Thank you.
Okay, so let me very quickly reintroduce myself. Like I was saying, I'm a physiotherapist by education, and I've spent the last 15 years working in healthcare in India. I spent the first 5 years building my own clinical practice and a ergonomic workshop organization. After that, I spent 7 years building India's largest home healthcare organization. And for the last 1 year, I've been working for HealthCube. HealthCube manufactures, designs, and delivers point of care technology. Our device has been, designed for remote and rural use, and it's our attempt to ensure that, the far areas of our country have access to easy diagnosis and better care. But now let's get to, talking about the emerging trends in Indian healthcare sector. And given that our countries are very similar in their needs and also similar in their current healthcare infrastructure, I hope you see the emerging trends in Indian healthcare and are able to relate with what's happening for you guys in your home country, right? So getting right to it, I hope everyone's able to see my slides. Yeah, all right. Okay, so healthcare is one of the biggest industries in India today in terms of both revenue and employment generation. In the overall healthcare industry, we obviously have the traditional hospitals, diagnostics, medical devices and equipment. We have insurance, telemedicine, which is a relatively newer player and becoming bigger. And of course, we have pharma. This sector is growing at about 22% year on year. And the hospital industry still continues to account for 80% of healthcare. And I'll talk about how this is slowly changing for us in India. This sector in India is one of the top 5 employers in the country. 7.5 million people are employed currently, and we expect to add 2.7 million jobs in the next few years. This country has 69,000 hospitals, but 63% of our hospitals, so the big bulk of our hospitals, are private. So that's the current landscape of the Indian healthcare ecosystem. What are the trends that are shaping the Indian healthcare landscape as we speak? So the first and probably the most important is the public spending and investment activity. There is now, after COVID, after the pandemic, we're seeing an increase in public and private investment. There is focus on infrastructure and education. So what we find is that the number of doctors and nurses and aides that we have is grossly limited. And of course, medical education takes a number of years. So there is an increased focus on improving our education systems, also improving the number of doctors and nurses that we can churn out per year. Penetration of healthcare insurance. So we're different. We're different from Europe and America. UK has its NHS, which gives basic care to all its citizens. US, of course, has a very deep insurance system, which drives how healthcare is delivered. India, unfortunately, insurance is privately owned mainly. And, very small percentage of our people are insured, which basically means when illness strikes, the entire family's finances can come under, the radar. So increasing penetration of healthcare insurance is something very critical for us. Now, sector-specific trends are emergence of healthcare or home care services. There has been a seismic shift in healthcare delivery. We are moving away from hospitals, which is traditional, to home care. I spoke in the beginning about how, in my previous slide, I spoke about the fact that 80% of, the country's healthcare is delivered in hospitals. Slowly, we're starting to see that shift, and more healthcare is getting delivered at home. Development of the telemedicine market. I think the pandemic was the greatest impetus all over the world, globally, and especially in India, which impacted the consumption of telemedicine. A time 2 years ago, no one would imagine the frequency with which they, now interact with doctors over a call or videos. I mean, it's dramatically changed. And the advent of health tech devices and gadgets, whether it's wearables, your Apple Watch, your Fitbit, your Holters, your point of care technologies, Internet of Things, IoT and connected devices are, we're seeing an upswing in it. And since I work in this device industry, let me tell you, even the public, we're seeing our state governments are now making investments in boosting the healthcare infrastructure by, investing in devices. So that's a trend that's up and coming. And we'll chat shortly about you're seeing the same thing in Africa, or if there's something different. Right. Emergence of home care services. I won't get too much into numbers because perhaps that's not very important to you. But we'll talk about, home healthcare emerging as a norm across the country and what are the factors that are driving it. First and foremost is the onset of COVID-19, which disrupted the conventional healthcare service. Of course, this helps in avoiding hospital-acquired infections significantly. We're seeing cost reduction on real estate and infrastructure because you don't necessarily need brick and mortar, kind of buildings all over the place, and a lot of healthcare can instead get delivered at home. The thought is, can we reach a point where only surgeries require hospitalization and all the pre-op and post-op care can actually be delivered at home? That's really where we are heading. Attractive financial benefits, of course, because, home care companies are offering all sorts of free consultations, discounts on lab tests, free medicine delivery, heavy discounts on pharmacy products, so on and so forth. Newest trend that we're seeing is that insurance organizations are starting to create a provision for home care services. And now this is very, very important in a country like India and maybe also Africa, because when insurance starts to cover home care, patients are automatically incentivized to go home instead of staying in the hospital. Let me give you an example. Traditionally, if a patient undergoes a total knee replacement, insurance will cover about a week of hospitalization, right? And the patient will want to spend that week in the hospital because, then nursing is covered, physiotherapy is covered, rehabilitation is covered, blah, blah, blah. Now, if insurance companies start covering some of this care at home, most patients will start wanting to go home on day 2, day 3, assuming their health permits. Early discharge leads to better, churn at hospitals, eventually requiring lesser infrastructure while delivering adequate care at home. So we've got some 3 or 4 very large organizations that have ballooned on the back of the pandemic. Portia is the organization I used to work with. It's the largest home healthcare company. We used to be in about 16 cities 2 years ago, and Portia by March will be in 42 cities, 50 cities by March. And they plan to scale to 100 cities. So penetration has improved dramatically. Nightingale's Healthcare at Home, Care 24, some other big names in India, but there's been a number of startups that are entering the home care service and elder care service industry. I'd love to know if that's happening in Africa as well. Increasing consumer receptiveness, obviously after the pandemic, people have become more okay with, getting certain things delivered at home. Doctors have accepted this mode of treatment. In fact, even something as serious as oncology. Oncologists are starting to accept delivery of chemotherapy drugs via IV at home. The way it works is the nurse goes to the patient's house, consults with their oncologist, ensures that they understand the mode of drug delivery, dosage, frequency, blah, blah, blah. And then they do the administration. At the end of the 4 hours or 6 hours that it takes to deliver the chemotherapy, they once again consult with the oncologist, ensure that the patient is doing well, and then go back home. So chemotherapy is now starting to be delivered at home. And this is a huge market, improves patient outcomes considerably, keeps them comfortable. Battling cancer is hard enough without, needing to go to the hospital. So these are the kind of services we're beginning to see getting delivered at home for the first time ever. I'm going to pause here, and I'm not sure whether you want to ask questions while I speak or you want me to go through the entire, session. So Ambola, if you want me to continue or do you want me to pause? Okay. All right. I'm just going to continue. Now, we spoke about the emergence of home healthcare, development of the telemedicine market. And there's some important, numbers out here. We've seen a growth of 31% just between 2019 to, FY 2022. And we expect this to go up by almost 4 times in the next 3 or 4 years. What are the factors that are driving growth? Firstly, there is low presence of doctors in semi-urban and rural remote areas, right? I'm sure it's the same, with you guys as well. Informed decision-making and better communication via telemedicine, innovative health tech products, which are actually making, teleconsultation very convenient. Let me give you an example. So we have primary healthcare centers in the rural parts of the country. And earlier, there might be a nurse manning it, or sometimes a doctor comes and goes. Now what happens is we're seeing connected devices being placed in these PHCs. The technician out there or the nurse out there is able to do some simple tests, connect via video or via audio to a doctor who can then look at the test results digitally, comment on what should be done with the patient next. Either it leads to prescription, it leads to further testing, or it may lead to, a referral to a bigger center. So the efficiency of this method and the low cost associated with delivering care digitally obviously is extremely helpful. Acceptance of telemedicine in India. So we, this company called BCG, Boston Consulting Group, did a survey of 800 physicians across tier 1 cities. And here is what we found. 85% of clinicians had used teleconsultation and digital platforms during the pandemic lockdown. 50% of the doctors found that digital platforms are very effective for patient interaction. 80% teleconsultation service calls were from first-time users. This is extremely important. 80% of these callers were first-time users, but they weren't the last-time users. Now that they've been introduced to this mode of teleconsultation, the expectation is that for certain kinds of diseases and problems, they will continue to use this modality to interact with a variety of doctors, which means the lifetime value of telemedicine is going to exponentially grow up. And that's where you see these projections that I've shared with you. Another important factor is that 44% of teleconsultation services were from non-metro cities. In India, that's very important. More than 75% of our country lives in smaller towns and semi-urban rural centers. The fact that almost half of our teleconsultations came from these areas means that people who would otherwise have foregone specialist consultation now have a means to connect with better doctors, hopefully leading to better diagnosis, better treatment, better care. One notable development is that many hospitals, Apollo is one of our largest hospital chains, and Apollo is making significant investment in its digital arm, in its telehealth arm. So even our corporate hospitals, the ones that make a lot of money on the back of treatment, are seeing this as a very wise investment. So public and private investment in telemedicine is more than it has ever been. Advent of health tech medical devices. India is the 4th largest medical device market in Asia, after Japan, China, and South Korea. I'm sure Africa as a whole is also an extremely huge market for medical devices. So that's something for you to consider. There are over 6,000 types of medical devices in the country, which includes point-of-care technology. 50 organizations which are currently engaged in innovations for addressing important health issues. This could be chronic disease management, it can be cancer, marker study, so on and so forth. I've written down names of some organizations that are doing work, but I would just choose one example to share with you. The first one, that's Beto. Beto has designed a convenient and smart device for measuring blood sugar levels. They've created an application. You use the device, test your blood sugar. Obviously, the data goes into the application, and you kind of map how your diabetes is playing out over a number of days, weeks, months, and years. Now, on top of this product offering, obviously, you'll have doctor consultations, you can have medicine delivery, you can have diagnostics, HbA1c, etc. being done. You can have nutrition consultation. You can also have specialists who can talk to you about dangers of diabetes. You can have people to address neuropathy, who address your retinopathy, so on and so forth, complications of diabetes. So a very simple device and an application, but there's a lot of value that can get added to the patient via this very, very simple, seemingly simple offering. So these disruptive innovations not only help in addressing healthcare issues, but they also build medical history and form of EHR, which hospital and care providers in case something, very, very adverse happens. I mean, we all understand the importance of data in today's world, but importance of health data at an individual level is extremely critical, especially when it's built over time. So that is something that we're now beginning to see. Public spending and investment, I spoke about it a minute ago. Won't spend too much of your time talking about India's budgets, but suffice it to say that there's huge public spending. Our budget is 16.5% higher than it was in the previous year. But if you look at the right side of the slide, you'll see the private investment, right? We're seeing the FDI, the foreign direct investment, almost double. And the number of healthcare companies that are going public and raising millions of dollars is very, very large. So we're very excited to see how all of this money which is flowing into this industry, how it actually gets utilized. Like I spoke about earlier, there is focus on infrastructure and education. This is very critical, a very important statistic to look at. We are seeing that the number of colleges in India are increasing at 6.3%, but the number of doctors is increasing only at 3.9%. There's a huge gap. There's a gap of almost 30% between the number of doctors that we should be seeing and the numbers that we're seeing. And this is just on the infrastructure we already have. Based on the way our population is growing and how the proportion of the elders is going to grow in this population, we need at least 600 medical colleges in this country. So we're about at about 90% of that, and we're very quickly trying to grow the base. We also are looking at creating 15 new super specialty educational facilities. So we call them AIMS. So that's going to come up. And another notable development for us is expansion to tier 2 and tier 3 cities. Now, the reason this is important is because traditionally all of your education is very focused on metros, and that's unhelpful because there's talent. 75% of our country is rural. There's talent in the hinterlands of the country, which is not really getting the exposure that it deserves. So this defocusing from metro, moving to tier 2, tier 3, obviously makes the cost of education come down, also makes education much more accessible to a wider population. So that's something critical that's going to happen in the next couple of years. Penetration of healthcare insurance. This is a topic that I find, there are two sides to every coin, and insurance coverage has its own pitfalls. But in a country like ours, where less than 10% of the country is insured, we have only 20% of non-life insurance business is from healthcare. It's a very, very sorry statistic, and we do need it to grow very dramatically. Now, what are the reasons that we're seeing this improve? Of course, the onset of COVID-19 led to an increase in hospitalization. And in June 2020, IRDAI, that is our insurance regulatory authority, they issued guidelines to health and general insurance providers to offer an indemnity policy, which means they mandatorily had to cover COVID-19 standard benefits. Insurance are now entering into strategic partnerships with established companies to offer COVID-19 insurance plans. Once this has happened, now riders are being added to cover hospitalization expenses, home care, and so on and so forth. We hope that this pandemic will shock our population into becoming more aware of insurance and investing in insurance premiums. So what are the key factors that support this theory? Firstly, there's the growing middle-class population segment with rising income level, the rising burden of new diseases like COVID-19 and black fungus, which our country suffered from, and 3 large states in our country, Bihar, Assam, and Sikkim, have become more woke, and there is an increased coverage in those specific areas, leading to an overall improvement. So in conclusion, the way forward, in a nutshell, the country's healthcare industry should continue to and enhance focus on 4 most important aspects. One is telemedicine, because it enables informed decision-making and communication between healthcare providers and patients regarding prevention, diagnosis, and management of health conditions. Advanced medical devices, I think this is very critical. It plays a crucial role in improving access to healthcare, specifically in rural and remote areas, through a point-of-care approach. And HealthCube plays a very small part there. I also want to take a minute to talk about the fact that we are certified to sell in several African countries. So if any of you think there is, interest and potential for collaboration, do reach out to me separately, and we can have a better discussion on this. Infrastructure development, building the required infrastructure and resources will help unlocking the unrealized potential to a large extent, given the geographic size of our country and also yours. Insurance penetration is a key element for overall ecosystem that helps in tackling a financial aspect of healthcare in a systematic manner and with much better preparedness. So thank you. I'm going to pause here and open this up for questions. And I hope I haven't exceeded the time that was allocated to. Someone has asked me a question about the penetration of health insurance. Health insurance is a highly regulated system in India, and our regulatory authorities actually made several bold moves. When the pandemic was going on, they made it mandatory for insurance companies to cover COVID-19 hospitalizations. Some of them also went out on a limb and covered home isolation for COVID-19 patients. This has increased the awareness about insurance dramatically. And of course, that is now helping people to adopt this practice. Still a long way for our country to go. I think our insurance penetration needs to be more like 60% for it to make any meaningful impact. So we have many, many strides to make. Thank you. John says that he found it insightful. Thank you so much, John. Does anyone else have any questions or insights to share with us, with the rest of the group? I'll be happy to share it out.
Hi, I had one question for you, please. And thank you so much for the presentation. Really, really interesting. I was going to ask of some of these different trends. It sounds like some of them apply, maybe to different economic strata of the society. Some maybe to upper middle class. Some maybe to lower middle, lower class. I think when the size of our middle class in Nigeria is a little bit smaller as a percentage. And I'm curious, like of the innovations you mentioned and trends, which are the ones that you've noticed are maybe that apply most to kind of lower middle and below? Was curious to ask.
I'm so glad you asked this question. I think it's a very, very relevant question. So thank you, Andrew, firstly, for asking this. Two innovations that I think would be most applicable to lower middle or even lower class, the ones who are the most at the bottom of the pyramid. One is the advent of telemedicine, because it helps them at a much lower cost to access better care than they normally have access to. And I'm talking about farmers and day laborers. Getting treatment to them often requires traveling. It requires half a day. It requires foregoing that day's pay. So it's a very, very costly affair, and then they can ill afford it. So teleconsultation is one. And the second is actually the sector that I work in, which is point of care technology. They kind of interlink, because if I can equip every single primary healthcare center, every single village with a single point of care device and a phone, they automatically have access to basic diagnosis. And access to a doctor who can act on the data that is available to them. So I think these are the two that helps really, the bottom of the society. Whereas insurance and home care are the ones that apply more to the upper middle or the upper classes of society. And I hope that's answered your question adequately.
Yeah, I think so. Thank you so much. Really helpful.
Thank you. I have a couple of more questions. Someone has said that they wanted the slides and the contact details. What I will do is I will share it with the host, Abimbola, and I'm sure she will, you can reach out to her for the same. And somebody's asking me, with this health insurance penetration, would it be advisable to manage healthcare startups with this model, with this mode? I'm not sure I follow this question, but let me try and answer. So I think in India, people are used to paying for healthcare out of pocket. And we have several startups who are leveraging people's willingness and ability to pay out of pocket. But insurance penetration does need to improve dramatically for the larger part of the country to be able to really leverage the services of the startups, right? So for instance, home care, let's say home care starts getting covered by insurance. There's only still 5% of the country, or 7% of the country that's going to leverage that cover. So unless the two move hand in hand, unless you have people, more and more people taking insurance, and then more and more services getting covered at home, unless the two happen hand in hand, the society as a whole isn't really going to benefit. And I hope that that answers your question. If not, do ask me a follow-up question. Okay. Great. Moses, yes, I'm sure Abimbola will share the recording with you as well. Okay. I don't see any further questions from the group.
Okay, thank you so much, Runam, for that super amazing section. I've registered. You'll be getting the recording and most likely the presentation.
Then we have Hi, Runam. Thank you so much. I'm trying to get to what
Great. I think it's time for you guys to have your mixer and your party. Thank you so much once again for having me. It was a pleasure.